February is American Heart Month, and today is National Wear Red Day. A campaign started to raise awareness about heart disease being the #1 killer of women. According to the American Heart Association, nearly 45% of women over the age of 20 are living with some form of cardiovascular disease. And here to help us understand the signs and how you can keep your heart healthy is Dr. Sheila Sahni. Welcome, cardiologist at Hackensack Meridian Health.
Good morning. Happy Go Red Day.
Yes. Now, so what are the key risk factors for heart disease that are unique to women?
The key risk factors that are unique to women actually show up in pregnancy: gestational diabetes, gestational hypertension, preeclampsia, and even issues with your placenta and preterm labor. These conditions alone can quadruple your risk for heart disease. But other conditions unique to women, like PCOS, early menopause, autoimmune conditions like lupus, rheumatoid arthritis, these can increase a woman's risk for heart disease.
And doctor, what are some of the most common warning signs of a heart attack that often go missed?
I want women watching to forget that classic Hollywood picture of a man clutching his chest and collapsing. For women, a heart attack often comes on more like a slow burn, not a lightning bolt. The symptoms can be unusual fatigue, shortness of breath, a pain in the neck, the jaw, the upper back, epigastric pain, and they can come on a few days before or even weeks before the actual event, so it's really easy to miss.
And how do milestones like menopause and pregnancy play a role?
So, pregnancy, think of it as your heart's first big stress test. It's hormone driven, and we see a lot of growth of new blood vessels. So, that's where we can see hormonally driven vascular changes that actually serve you unwell as you get older and out of the pregnancy. Menopause is a moment where the protective shield of estrogen leaves the body. And almost overnight, you could see blood pressure and cholesterol levels spiking. So, these are two really critical moments in a woman's life where they have to ask their doctor about cardiovascular disease risk.
And with heart attacks on the rise in younger women, especially those in just their 30s and 40s, how would you advise them to protect their health?
So think of your 30s and 40s as your prevention decade. And I want women to really be the CEO of their own health. When they're in the exam room, I want them to actually ask, what are my blood pressure numbers, cholesterol numbers, and blood sugar numbers? And if they're experiencing symptoms, don't just describe them. Ask directly, could this be my heart? Be open, sharing your family history, your pregnancy history, but don't just stop there. When it comes to a woman's heart, persistence saves lives. So don't be afraid to get a second opinion to get the answers that you need.
Such good advice. Dr. Sheila Sahni, cardiologist with Hackensack Meridian Health. Thank you so much for being with us this morning.